Thank you guys and ladies, for all of your great service as MRC volunteers. Appreciate all the great hours and the time that you've put in serving your state and your local communities, and really am humbled and appreciative of all you do. Tonight we have another excellent presenter. So I'm pleased to present Ms. Myra Tigreros, who is a highly experienced professional with a strong background in healthcare and training. As the Northern Virginia Regional Trainer and VDH Lead Trainer for the past 2 years, Myra has been instrumental in developing and delivering comprehensive training programs. Prior to her current role, she served as containment supervisor in Loudoun County during the COVID-19 response. With an impressive career spanning 30 years in the medical field, including 25 years in management, Myra brings a wealth of knowledge and expertise to her training initiatives. She has accumulated 10 years of teaching and training experience in allied health, making her a versatile and effective instructor. Myra holds certifications as a medical assistant, phlebotomist, and EKG technician, and has been a certified allied health instructor since 2004. Before joining VDH, Myra held several significant positions at EHE International as a clinic director for 10 years and as the manager of the Department of Medicine at Howard University Hospital for 5 years. These roles allowed her to develop a deep understanding of operational excellence in patient care. Myra's academic qualifications include a bachelor's in the arts and business with a minor in health management, which has equipped her with a solid foundation for managing healthcare training programs effectively. Ladies and gentlemen, Myra Tigreros, over to you.
Hi, everyone. Thank you, Mike, so much for your presentation. Right, so I'm going to go ahead and start by presenting my screen, so just bear with me a few minutes. There we go. Okay. All right, hi, everyone. So today's training is called Introduction to Public Health Surveillance and VDH, also known as EPI Day. The course topics that we're going to be discussing are public health definition terms, history of public health and mission and fundamentals, core functions and essential services of public health approach, stakeholder roles in public health, determining and influencing the public health case investigation and contact tracing, as well as science and EPI of COVID-19. Now, the learning objectives are going to be, after this course, you will be able to describe the purpose of public health, define key terms used in public health, identify prominent events in the history of public health, recognize the core public health functions and services, describe the role of different stakeholders in the field of public health, list some determinants of health, and recognize how individual determinants of health affect population in health. Now, the first thing we're going to talk about here is going to be, we're going to do a quick overview of what public health is, along with key terms associated with public health. So the first thing is, what is public health? So the CDC used the following sentence to define public health. It is defined as the science and art of preventing disease, prolonging life, and promoting health through the organized effort and informed choices of society, organizations, public and private communities, and individuals. And this definition was actually taken from CEA Winslow. Now, continuing with public health. What is public health? Now, we heard the previous slide what public health is. And in the slide, we will learn more about how we can achieve that. We can start by addressing systematic inequities that impact health, which are the differences in things like where we're born, work, live, that determines our access to resources we need to be our healthiest self. Now, public health also focuses on population-based approach, which focuses on society as a whole rather than the individual. Upstream focus instead of focuses on the issue and the problems that cause downstream. Public health focuses on the upstream, the causes of potential health issues and how to prevent them. The goal is to prepare future generations to choose and maintain healthy behaviors. Now, effectively, public health interventions are holistic, which means they treat health as a whole rather than a single aspect. In other words, public health includes all of the organized and holistic efforts to improve policy, education, and access to make the healthiest choice the easiest choice for everyone. Now we're going to talk a little bit about some key terms. So the first one is clinical care. And these are terms that you might be familiar with already or will become familiar during your work. So clinical care, it's prevention, treatment, and management of illness and the preservation of mental and physical well-being through the service offered by medical and allied health professions, also known as healthcare. A cluster refers to an aggregation of cases grouped in places and times that are suspected to be greater than the number expected, even though the expected number may not be known. Health outcomes is the result of a medical condition that directly affects the length or quality of a person's life, and determinant is a factor that contributes to the generation of a trait. Now, endemic and epidemic and pandemic, we're going to talk a little bit about the differences between these. So, endemic or an outbreak, which is an event that occurs that is clearly excessive or a sudden start to the normal expectancy for the community or region. Now, this event are positive cases of a particular illness, specific health related behaviors, or can also be other health related. Now, both terms are used interchangeably. However, epidemic means usually refers to an increase, often sudden, of a large number of people within a geographical distribution. It could be a community, a population, or a region of illness or health related event. Now, an outbreak is used for a more limited geographical area. Now, pandemic are epidemics or outbreaks of disease that spread far and wide, affecting the population or multiple countries or continents. Now, endemic is disease existing at a certain and or constant level of presence within a geographical area. I'm sorry, my screen seems to be stuck.
You may want to try refreshing.
Okay, let me try that.
And you should see to be able to progress your slide down on the left.
Okay, let me.
Okay, try that now. Let's see.
Yes, there we go. Much better. Thank you so much. All right, so the additional key terms we're going to discuss are the morbidity rate, which is the rate of disease in a population, mortality rate, which is the measures of the frequency of death in a population during a specific per rate. Rates are often disease specific, and disease surveillance, which is a systematic ongoing collection analysis, and interpretation of data, included dissemination of information regarding the occurrence of disease in a defined population for, for to reduce morbidity and mortality. Now, we're going to talk a little bit about what is epidemiology. So it's the study of the distribution, which means the frequency and determinant of health-related states, or even in specific populations, and the application of this study to the control of health problems. It investigates patterns and cause of disease and injury. What it does is it tries to learn the who, the what, the when, the where, and the why of disease. Health-related state doesn't have to be infectious disease. It could be an infectious disease like COVID, for example. It could be non-infectious disease like heart disease or obesity. Effects of a bike helmet or on injury. There are factors that can increase and or decrease the likelihood of disease. And our goal is to identify the source to stop the spread. Now, who are EPIs? Now that we know what epidemiology is, we're going to learn a little bit more about what EPIs do. So in other words, excuse me, EPIs are researchers who study disease and health outcomes, analyze data, work to understand the cause, distribution, and control of disease, injury, disabilities, or health outcome in a population. In other words, they are disease detectives, and they use what is called the EPI triad to determine and find additional information. Now, the EPI triangle is a model that scientists have developed for studying health problems. It can help understand infectious disease and how they spread. These are the four parts. We have the vector, which is the carrier of the agent that is transferred to the host. For example, such as a mosquito carrying virus or a bullet being fired from a gun. We have the host, which is the organism and or the person who is harmed and or injured by the agent through the vector. Can be a person and animal, may or may not become sick, injured, or affected. We have the agent, which is the microbe, the energy, or other factor that causes the disease, injury, health outcome. For example, it could be bacteria or a virus. And we have the environment that can be external, internal, physical, or social factor that allows transmission of the disease, injury, or health outcome. The environment allows for the vector carrying agent to transfer to the host. Now, types of epidemiology, we have descriptive, which answers the question of who, what, when, and where. And we have analytic, which answers the questions of why and how. Now, descriptive epidemiology talks about the place, which is where, may include information on where someone lives, works, or goes to school. A person, the who, may be characterized by the age, race, sex, their education, or other characteristics. The time, when, may include the time of illness onset or time of exposure. Now, based on these factors, data analysis examines and reports measures of frequency and extent as an impact, as they impact. Now, analytical epi, which is the why and the how, okay. What it does is it describes the epidemiology to answer the why and the who and the how. It is used to help us understand the cause of a disease, which typically involves designing a study developed through descriptive epidemiology observations. A comparison of a group is needed in the analytical epidemiology, which is why I like this particular picture here, because it goes into trying to figure out what went bad first, right? The chicken salad or the egg salad. So it's just sort of like a slight little joke on what we're trying to do here. Right now we have knowledge check number 1, and what I would like to do is going forward with the rest of the knowledge checks is if you could select your answer and then put it in the chat, and then we can see if, and then I will go ahead and read the correct answer. So for this knowledge check number 1 is, and blank is a disease occurrence among the population that is in excess of what is expected for a given time and place. All right, so I'm seeing a lot of people putting D, and that is for epidemic or outbreak, and that is correct. Knowledge check number 2, blank 22 cases of legionellosis occurred within 3 weeks amongst residents of a particular neighborhood. Usually it occurs in 0 or 1 per year. Now, what would be the answer for this? Is it endemic, pandemic, or epidemic? All right, so it seems to be between, I see people here putting epidemic, and also some of them are putting endemic. All right, and the correct answer is C, epidemic. Now we're going to go ahead and move to another topic. Now let's review the history of public health. We will take a look at a few historical highlights through 4 lenses. We're going to look at sanitation and environmental health. We're going to also look at pandemics, disaster response and preparedness, and the last one is going to be prevention and policy. All right, so first we're going to start with John Snow. He is a British physician who had a different opinion of the spread of cholera during 1954 Broad Street cholera outbreak. Now, he created a map depicting where cases of cholera occurred in London, West End, and found them to be clustered around a water pump on Broad Street. He believed that the illness was spreading by way of contaminated water supply because the sewage was routinely dumped into the same river and cesspools near town well. His research changed the way we look at disease, and because of this work, the source and the tracing of the source of cholera outbreak, he is often considered the father of modern epidemiology. Now we're going to talk a little bit about sanitation and environmental health. So the first lens we look through encompass the control of disease and promotions of health through sanitation to ensure a healthy environment. Now here are 3 examples of how public health has worked to contain infectious disease through environmental measures. The first one is around 500 BCE, the ancient Greek and Romans actively practiced community sanitation measures. Approximately on the second one here, approximately 2 millennia later, the Public Health Act of 1848 was established. It provided a central board of health and placed responsibilities for sanitation in the hands of the boroughs. And the last one is in 1970, the Nixon administration established the Environmental Protection Agency, which protects human health by safeguarding air, water, and land. Next we are going to explore pandemics. Pandemics are epidemics or outbreaks of disease that spread far and wide, affecting the population of multiple continents. Now, influenza or the flu has caused pandemic many times during both the distant past and recent history. Almost a century ago, the Spanish flu infected 500 million people across the world, including remote Pacific islands and the Arctic, killing 20 to 50 million people. More recently, the influenza pandemic of 2009 infected persons in 214 countries, causing almost 19,000 confirmed deaths. Now, preparing and controlling the effects of influenza will likely remain top priority for public health. Now, historically, moving on now to polio, was a common and highly feared disease that caused severe illness, including paralysis and death among thousands of people each year. Thousands of people lined up to receive the polio vaccine after it was introduced in 1955. The initiative to eradicate polio was launched in 1988 because of the outbreak in more than 125 countries. Today, polio exists only in a few countries. Now, during the 1980s, human immunodeficiency virus, or HIV, emerged and spread rapidly across the globe. Public health has responded to this pandemic by developing new ways to diagnose and treat those who are infected. New infections of HIV are down by 20% over the past 10 years, which is a sign that public health interventions are successful. Now we're going to talk a little bit about preparedness and disaster response, both of the natural disasters as well as human-made threats. Now, the use of biological warfare to infect people and animals goes back centuries. During the siege of Kafta, which is in Crimea, in the 14th century AD, the attacking Tatar force used plague as a weapon of war by hurling plague-infected corpses into the enemy city. Their actions started the first stage of the Black Death or plague amongst Europeans. Now, another more recent example is when the British gifted smallpox contaminated blankets to the Shawnee and the Lenape in Delaware communities in 1763. Now, in the immediate wake of the terrorist attack on September 11th of 2001, public health workers were on the ground at the World Trade Center and the Pentagon conducting surveillance to identify outbreaks of disease or other possible health conditions resulting from the attack. Public health workers closely monitor the health of first responders, city residents, and environmental conditions to detect health threats during the cleanup after the attack. Now, after Hurricane Katrina in 2005, public health workers and other disaster relief agencies tirelessly provided emergency services. Teams were dispatched to conduct surveillance for illness and injury among people who evacuated to shelters and other places of refuge after the storm. Now, prevention through policy. The last lens we look through as we view public health history is prevention and policy. Public health works to protect and improve health, not just by responding to disease outbreaks or preparing for natural and human-made disasters, but also by implementing policies that support these efforts on a society level. As far back as 1500 BCE, Letivius, the third book of the Hebrew Bible, is believed to be the first written health code in the world. The book deals with personal and community responsibility and includes guidance regarding bodily cleanliness, sexual health behaviors, protection against contagious diseases, and isolation of leopards. During 2000 to 2004, cigarette smoking was reported to be responsible for $193 billion in annual health-related economic loss in the United States. Laws banning smoking in the workplace and other public places have been developed to encourage smokers to quit while protecting non-smokers from the effects of secondhand smoke. And finally, based on the 2020 statistics, more than 1/3 of the US adults and approximately 20% of children and adolescents ages 2 to 19 years of age are obese. That's about 14.7 million children and adolescents. Now we're going to go ahead and discuss knowledge check number 3. And in knowledge check number 3, blank, over 20 million people worldwide died from influenza in 1918 through 1919. What would be the answer there? Yep, it is the pandemic. Everyone got it correct from what I'm seeing on the chat. Right. Now we're going to talk about our third topic, which is public health mission and the fundamentals. Right, so the mission of public health, the Institute of Medicine states that the mission of public health is fulfilling society's interest in assuring conditions in which people can be healthy. Similarly, the World Health Organization, also known as WHO, strengthens that the public health aims to provide maximum benefit for the largest number of people. Public health focuses on groups of people rather than just an individual. At the core of public health lies the principles of social justice, providing people the right to be healthy and to live in conditions that support their health. Fundamentals of public health. Now, the mission of public health is to prevent disease, protect the health of our community, and promote healthy behaviors. So the fundamentals of public health include, recently, like pertussis, contaminated water wells, like the gas leak in Clark County, for example, car seating initiatives, sex education, like preventing STDs, flood response, like Red Cross when Katrina occurred, and then the Joint Commission on Accreditation or Health Care Organization known as JCAHO, which is Federally Qualified Health Center, and to effectively respond to any emergency impact public health through preparedness, collaboration, education, and rapid intervention. The public health response: when disaster occurs, national organizations and public functioning governments and title entities like local, state, and federal have an obligation to provide relief to communities with the goal of preserving the well-being of the people. Now, identifying the source to stop the spread, for example, contact tracing is how we help mitigate the spread of disease, which is something that we did with COVID-19. The public health local and national level. Now we have the national level, which is the CDC, which acts health threats spans more than one state or region. It tracks national trends. It consults when states or districts lack resources or expertise to respond. We have the state, which is central office in Richmond, Virginia. DGS, which is the State Laboratory Services, statewide trends, regional trends. It consults with regional or districts when they don't have the resources or the expertise to respond. And then we have the local health districts, which assist with immunization, communicable disease like TB screening, and investigation, STDs, outbreaks, infections of food establishments, daycare. It also works with WIC and family planning. All right, so now we're going to take a little look at the goals and the mission and vision and core values of VDA. So the mission is to prevent the health and promote the well-being of all people in Virginia. The vision is to become the healthiest state in the nation. The core values is our culture, values, services, equity, and making data informed decisions. The goal is to maintain a competent and valued workforce. This results in retain the best employees, ensure that VDH staffs are properly developed and coached, plan for knowledge transfer and future succession, and demonstrate that VDH employees are valued. Foster health, connected, and resilient communities. Uh, 3 is to be trusted source of public health information and services by delivering public health information accurately and timely in the format and delivery method in which it is most effective. Assure the conditions that improve health communities by building rapport at the state and local levels to increase community capacity to focus on determinants of health. And the last one, to provide internal systems that deliver consistent and responsive support by creating a culture of continuous quality and process environment at VDH. Establish an internal culture of customer service excellence. All right, now we're going to take a quick look at the different areas within Virginia of the health regions. We have the Northwest, which is this area here that is in green as you see here. We have Northern Virginia, which is this area over here in kind of like a pinkish reddish color. We have the Southwest, which is the magenta color down here, number 3. We have Central, which is all the orange colored areas right here. And we have Eastern, which has all of the kind of yellowish tones towards the right. Right. Now we're going to discuss reportable disease. So what is reportable disease? There are certain diseases that are required by law to be reported by labs, healthcare providers to local, state, or federal health entities like the CDC. Why? Because reporting positive cases is how public health organizations monitor the trends and trace disease on a large scale. Now, some samples are outbreaks, viral hepatitis, vector-borne disease like ticks and mosquitoes. We have enteric diseases that caused by microorganisms such as viruses, bacteria, and parasites. We have vaccine preventables, and then the scary one, which is the plague and anthrax. All right, so now we're going to talk a little bit about disease reporting requirements. Now, the disease that must be reported are those on the reportable disease list. Any outbreak and any unusual on health concern. Now, physicians and or laboratories are medical facilities are all required to report. Schools, daycares, camps, and residential facilities are also required to respond to suspected outbreaks. Now, here in the next slide, I'm going to show you guys a list of the reportable disease list. Now here, as you can see, that the list is divided into 2. We have the ones that are underneath the red, which need to be reported immediately. And then we have the other ones that are under the blue list on the right-hand side, which are reportable within 3 days. All right, now we're going to talk a little bit about the electronic case report, also known as the ECR. Is the automated real-time exchange of case report information between electronic health records and public health agencies. It allows for secure transfer of patient and clinical information between the healthcare and public health for disease tracking case management, and contact tracing. Now, the data is securely moved from the electronic health record in healthcare facilities to state and local public health management. It provides more timely and complete data that manual reporting and decrease the burden of healthcare and public health staff. Now, electronic laboratory reports, also known as the ELR, is the transmission of digital laboratory reports from laboratories to state and local public healthcare systems and the CDC. The ELRs automate a large portion of the reporting process by translating the information into laboratory electronic message that can be automatically sent and processed by the public health agency. Now, we're going to talk a little bit about some of the misconceptions within the health department. Now, some of them are that we directly monitor people, track them down, and penalize them because of their diagnosis, that we police or deport people, that we blacklist people in the community, that we capitalize of the sick and the vulnerable, that we stigmatize and out people that have tested positive for an infection, that we care solely about stats and data reports. We are not here to punish or scare, we're here to help. And that's one of the most important things that we have to make sure that we convey to individuals when we are speaking to them, and make sure that they understand that none of the things that I read here are actually what our job or what we do. We actually do the opposite. Our job is to help them, give them the correct information, and be able to provide assistance as best as we possibly can. All right, now we're going to talk about knowledge check number 4. And knowledge check number 4 is public health aims to provide blank with the right to be healthy and live in conditions that support health. What would be the answer to that? The answer to that is groups of people. Remember, we work for a group of people, not just for the individual, even though we do assist our customers who end up being individuals, okay? Now let's take a look at the core functions and services of public health. Now, the 3 core functions of public health. Now, in 1988, the Institute of Medicine defined the core functions of public health agencies that must be carried out at all levels of government for the overall public health systems to work effectively. The 3 core functions are assessment, policy development, and assurance. Now, assessment is known what needs to be done. Policy development is being a part of the solution to get it done. And assurance is making sure it gets done. All right. Now, what are the 2 functions, the 2 fundamental goals of local public health departments? The mission of public health is to prevent disease, protect the health of our community, and promote healthy behaviors. Now, the goals and vision of the VDH EPI program is the vision to capable and confident staff able to handle the local calls and investigation. The goal is to have every disease reported, evaluated by a CD investigator, have every disease report and investigation captured electronically, which would be in VEDS, and quality investigation performed in a timely manner. Right, now we are up to knowledge check number 5. Which of the following is not a core function of public health? Assurance, assessment, authority, policy development. Yep, most of you are getting it correct. It is authority. That is not something, unfortunately, right, that we do. We provide policy, we provide guidance. All right, now we're going to talk about public health approach. So the 4 questions to ask when using a public health approach and term problem on the far left with the arrow pointing to the term, okay? Response on the far right. Now let's talk about the public health in a broad context. Public health problems are diverse and can include infectious disease, chronic disease, emergencies, injuries, environment, health problems, as well as other health threats. Now, regardless of the topic, we take the same approach to public health problems by following 4 general steps. Now, the first one is, what is the problem, right? In public health, we identify the problem by using surveillance systems to monitor health events and behaviors occurring among the population. The second are the factors that might make certain populations more susceptible to disease, such as something in the environment or certain behaviors that people are participating, right? What caused it? The third is what works. Once we identify the risk factors related to the problem, we ask what interventions work to address the problem. And the last step is, how do we do it? So, how do we implement the interventions? Given the resources we have and what we know about the affected population, will this work? As we go through this course, you will see the different examples of this public health approach at work. The public health core sciences. Now, to implement the public health approach, practitioners use and apply scientific methods. These methods come from a series of core sciences that provide the foundation. These sciences include public health surveillance, which we use to monitor a public health situation; epidemiology, which enables us to determine whether disease originates, how or why they move through populations, and how we can prevent them; public health laboratories, which support public health by performing tests to confirm disease diagnosis. Laboratories support public health by conducting research and training as well. As we continue to move from the use of paper documents to electronic health records, public health informatics continues to increase in importance. Informatics deals with the methods of collecting, compiling, and presenting health information. It enables us to electronic data effectively when addressing a public health situation. Prevention effectiveness is closely linked to public health policy. Prevention effectiveness studies provide important economic information for decision making to help them choose the best option available. Now, together, these 5 core sciences can help us protect and promote the public health by giving public health practitioners the answers they need. Now, examples of public health achievements. In vaccines, it's the polio eradication, control of infection disease, a shift from communicable disease, TB, as a major cause of death to a non-communicable disease, for example, heart disease; tobacco use as health hazard; and fluoridation in drinking water. Now we're going to talk about types of public health problems and/or events investigations. So environmental exposures could be lead, heavy metals, air pollutants, or other asthma triggers. Infectious disease, it could be foodborne illnesses, influenza or pneumonia. Injuries, it could be increase in homicide in a community. Oh, sorry about that. I'm not sure why that did that. Sorry about that. Non-infectious disease could be localized or widespread rise in a particular type of cancer, increase in a major birth defect. A natural disaster, it could be, for example, Hurricane Katrina and Rita, for example, in 2005, or Haiti earthquake that occurred in 2010. And then terrorism could be like the World Trade Center, which occurred in 2001, or the anthrax release that also occurred in the same year of 2001. So these are examples of areas of public health. We have EPI, we have maternal, child, and health. We have food secure and access. We have environmental health, cancer research, substance abuse, young violence prevention. Those are some of the examples where the public health, some people are not aware, but they also work within that arena. All right, now stakeholder roles in public health. Now, the field of public health is broad and interdisciplinary, and beyond government, it requires stakeholders with skills in intervention programs, policies, research, evaluation, and education. And that's why some of these individuals, or I should say programs, could be a program of individuals that you see up here, like community clinical care delivery system, employers and businesses. All of these individuals and groups together assist public health as partners. Now, non-governmental organizations, often referred to NGOs, play a key role in public health, especially at the community level. Now, NGOs serve many different purposes, from advocacy and education to emergency relief and economic development. General types of NGOs include professional membership organizations, such as the American Public Health Organization, organizations that focus on specific health problems, for example, the American Cancer Society, citizens groups such as the Americans for Non-Smoking Rights, and the foundations that support health projects and work at the policy level, such as CARE, which fight global poverty, and the Bill and Melinda Gates Foundation, which funds public health projects around the world. Now, healthcare plays a vital role in protecting and promoting the public health along with public health organizations. The two have differences that are highlighting here. Now, public health focuses on population, while clinical care focuses on individual patient care. Now, here are some of the other primary partners in public health. Increasingly, social media serves as a vehicle for public discourse and public health concerns, and historically, public health agencies and other partners have educated the public and promoted healthy behaviors through the news and entertainment media. Now, employers and businesses contribute to the public's health by providing health insurance, for example. Workplace also have wellness initiatives, such as gyms subsidized, that promote the health of their employees. Now, government agencies such as the CDC work in partnership with state, local, and tribal health departments. However, important contributions are made by other government agencies at all levels. Right, determining and influencing public health. As we discussed previously in the course, certain factors determine a person's state of health. Scientists generally recognize these health determinants for any population. Now, you have genes and biology. It could be, for example, sex, age, genetic makeup. health behaviors like smoking, eating habits, physical activity, social and societal characteristics like discrimination because of income or sex, where a person lives, including specialty air, water, and sanitation qualities, and then health services or medical care. Now, what determines the health of a population? The chart is a estimate of how these four major determinants influence health at the population level. Notice the portion of the chart that represents the medical care. We spend trillions of dollars in healthcare, yet it only determines about 25% of our health. The remaining 75% of what determines our health as a population is our total environmental ecology, including the social environment in which we live, plus our health behaviors, and to lesser extent, our genes and our biology. Right, now we're going to talk a little bit about public health care investigation and contact tracing. So the Office of EPI, for the role of the Office of EPI is to work in conjunction with local health districts to prevent and control the spread of communicable disease. Here in the Commonwealth of Virginia, the staff of the Office of Epidemiology conducts surveillance, provides direction, and support to ensure that protective interventions are taken for promoting the health and quality of life for every Virginian. Now, the mission of the Division of Surveillance and Investigation is to serve as the citizens of the Commonwealth by monitoring for the occurrence of reportable and emergent disease or suspected outbreaks of otherwise, providing recommendations and guidance to prevent the spread of communicable disease, investigation, outbreaks, or disease, and other public emergencies. Now, public health response of the Virginia Department of Health. When disaster occurs, national organizations and public functioning government entities on the local level works to provide relief to communities with the goal of preserving the well-being of the people. Case investigation and contact tracing are just two examples of measures to protect the community and from transmission. Okay, now we're going to talk a little bit about exposure, infection, and outcome. So what is exposure? It contacts with something that causes illness. In the case of infection disease, this represents interactions with the human, animal, or environmental from which the pathogen can be transmitted. Infection, when the body is invaded by an infectious organism. The outcome can be illness, disease, or diagnosis. Case definition is the standard criteria for classifying whether a person has a particular disease, syndrome, or other health condition. Now, I have two questions, and if you guys can go ahead, just like we've been doing previously in the chat, and just go right ahead in the chat and answer based on what you believe the answers should be. Does exposure always lead to infection? No, that is correct. And does infection always lead to disease? No, it doesn't, right? Why? Because sometimes the affected cells, right, what it does is it will kickstart our immune system, and then it will not allow the disease to start. All right, now we're going to talk a little bit about surveillance. There are 4 types of surveillance. The first one is passive surveillance, which passive surveillance is provider-based approach, which is based on state's official list of special list, provides report directly to the local health department, and lab reports to the local health department as well. We have active surveillance, which involves a regular systematic effort to contact reporting sources or to review records within an area. It can also involve outreach to reporting sources to ensure complete reporting or conditions or personal visits or calls to providers and labs. Sentinel surveillance, which is the reporting of health events by health professionals who are selected to represent a geographical area or a specific reporting group. These types of surveillances can be active or passive and is meant to serve as a lookout for certain health events. And lastly, we have syndromic surveillance, which focuses on symptoms rather than physician diagnosed or laboratory confirmed disease. It is a newer type of surveillance activity and collects and analyzes pre-diagnosis data, estimating the likelihood of cases needing further public health follow-up. It's used to detect outbreaks with bioterrorism, though it is not yet fully developed or cost effective. Now, the purpose of surveillance is to monitor changes in infectious agents, to determine geographical distributions of illness, to portray the natural history of disease, to estimate the size of a health problem, to monitor disease trends, to detect outbreaks, and to evaluate intervention activities and facilitate planning, research, and policies within public health. Now, the goal of a surveillance system is to guide public action by detecting outbreaks, detecting public health threats, detecting infectious cases, case finding, monitoring trends in a target population, monitoring exposed individuals for symptoms, monitoring threat individuals for complications, direct public health intervention, evaluating public health interventions, as well as generating hypotheses for further evaluation. So now we're going to talk about the national case surveillance a little bit more. Now, the case surveillance public health helps officials understand where, when, and which population transmission and/or transmission may occur. Now, information collected may include demographic information, clinical factors, characteristics, exposures and contact story, and course of clinical illness and care received. Now, the NNDSS or VED here in Virginia uses these data to receive, process, and provide data on a national basis. So here is how that works. The information comes from your hospital, your healthcare provider, the laboratories. It goes into your local, state, territory, or tribal territory, public health authority. And then from there, once all the cases have been completed, then only the data, okay, analytical data gets transferred over to the CDC. And that's also very important for you guys to be aware of, that we only share analytical data, because there are going to be instances where our customer may ask, who do you share our information with? We only share analytical data with the CDC, and this analytical data is not capable of being traced back to the individual. It will be something like a zip code, the state, the city where they live. It might have like their gender, the zip code, as I mentioned, but it will not have like their name, their date of birth, uh, their their address, for example. Anything that can actually pinpoint where they are or how they can be located is not shared with the CDC. All right, and then in turn, the CDC shares their analytical data again with the World Health Organization. Now, the goal purpose for case investigation and contact tracing. Now, the first thing is that it reduces and it controls the spread of disease in our community by identifying people who have tested positive. The CI work starts at that point and, and to notify those who have come into contact with them. And that's where the CT work starts. And that is contact tracer and case investigator is what CI stands for. But it also provides education about disease, guidance on isolation and quarantine. It gives our community guidance on how to stay healthy, patients, and our community. And it also assists in resources navigation, testing, food, shelter, or anything else the individual may need. Right, so now we're going to talk a little bit about chain of infection. So the reservoir, okay, which is the first port here, of an infection agent is the habitat in which the agent normally lives, grows, or multiplies. Then we go to the transmission. Transmission refers to the way the germs are moved to the susceptible person, right? Which is the mode of transmission. And that could be direct contact, or it could be um, droplet spread. It could be also indirect contact, which includes airborne, as well as vague clearborne vehicle. So there's a lot of different ways here that things can move around within the I'm sorry, my mind just went blank. Within the mode of transportation. Okay. Then we have the host, and of course the host is the link, is the final link in the chain of infection. Is susceptible host, and if there is susceptible host, that is when the individual can become infected. Now here we have cases and contacts, and we're going to talk a little bit about what they are. So a case is reports of a person with a condition or interest and event with a confirmatory laboratory. It could be a confirmed laboratory. It could be a positive antigen. Also can be an EPI link, and all of these are depending on the condition of interest that we are investigating. Now, close contact through proximity and duration of exposure. Someone who was in the presence, again, per condition of interest, and distance specs from an infected person. And for this infected person, of course, had to be, again, laboratory confirmed or a clinical diagnosis for a total of, again, depending on the time frame that is needed. All of these is what a case means in a contact. And I do have to provide a little bit more of a vague definition only because they are going to be different depending on the condition of interest that we are investigating. Now here we're looking at infectious period. The infectious period is the period of time in which the patient is contagious to others. This will not always align with when someone feels sick. Okay, that's one of the most important things that we have to remember. And also the infectious period is going to be different depending on the condition of interest that we are investigating. Now, the incubation period is the period of time between the exposure and the symptom onset. Depending on the disease, the incubation period can vary widely. For example, it can be as short as 2 hours, as it can be with a case of cholera, or it could be as long as 60 to 150 days, as the case with hepatitis B, for example. And then here on you see a couple of other ones. We have chickenpox, which is 10 to 21 days. We have Salmonella, which is 6 to 72 hours. We have SARS, which is 2 to 14. And then we have monkeypox, which is 3 to 7 days. Now, what is isolation? So it is used to separate people infected with the virus from people who are not infected. This includes those without symptoms but a positive test. People who are in isolation to stay home for the required days based on the onset or test day, depending on the condition of interest. And if it's possible for them to stay within a sick room, then if it's possible, that will be what would be recommended. Now we're going to talk about quarantine. And for quarantine, what quarantine does is it separates and restricts the movements of people who were exposed to a contagious disease to see if they become sick. These people may have been exposed to a disease and do not know it, or they may have the disease but do not show symptoms yet. And again, depending on the condition of interest, there are certain quarantine guidance that they have to follow. It could be as staying away from others. It could be as wearing a mask. For example, for COVID-19, and then it could be a number of different things depending, again, on the condition of interest. Right, now we're going to talk a little bit about COVID-19, since I know that that's one of the things that we've been dealing with the most this past couple of years. So, so SARS-CoV-2 is coronavirus 2019 is what it equals to. And SARS-CoV-2 is the virus. COVID-19 is the disease caused by the virus. And I always like to start by providing this explanation because there are times when people get confused. Okay. Now we're going to talk here a little bit about coronavirus families of respiratory viruses, family respiratory viruses. So here we have examples of coronavirus. We have the common cold. We have the novel coronavirus. We have SARS-CoV. We have MERS-CoV, which is the Middle East Respiratory Syndrome. We have the regular SARS-CoV-2, which is COVID-19. And I have some specs that I put here, updated here yesterday from when it started on winter of 2019 to present. And again, this was updated yesterday. And globally, it has 767 million cases and 6,000.9 million deaths. In the US, we have 103 million cases and have a little bit over 1.1 million deaths. Now, transmission occurs when exposed to infectious respiratory fluids in the following three ways. It could be through inhalation of air carrying very small fine droplets and aerosol particles that contain infectious virus, deposition, which is of the virus, which is carried in exhale droplets and particles onto exposed mucous membrane, like sprays, for example, such as when you cough or you sneeze, and then touching mucous membranes with hands soiled by exhalatory fluid containing virus, or from touching in an inanimate substance surface containing the virus. Now, the risk of SARS-2 infection varies according to the amount of virus to which the person is exposed to as well. All right, now the takeaways here is it is important to identify those most impacted by disease. Realize that the work that you all will be doing is serious. It is the work necessary in helping our community understand who is affected, where there is an increase in infection. and you will be speaking with members of the community that are sick, vulnerable, scared, that are being misinformed about the virus, that may have been stigmatized for testing positive previously on other conditions of interest, for example. So they have a complete different understanding or what happened to them in the past, right? So that's why it's important for us to make sure that we collect as much data, that we talk to them and explain to them that, you know, for whatever condition of interest that we're helping them with, that they understand that our job here is to assist them as best as we can. And sometimes it also means listening to them, just vent a little. And that's something that when I worked at Loudon, for example, um, the staff and myself sometimes had to do. Sometimes people were just angry and they just wanted to vent, and after they did that, they had like a complete different demeanor all of a sudden. They felt that somebody had heard them, they felt heard, they felt validated, and now all of a sudden they were more reluctant to less reluctant to listen to the guidance we had to provide for them or to answer our questions. So don't forget that these are individuals that we are dealing with that you know, have all kinds of different problems just like we do, and we never know when we call them what kind of moment we're catching them. So it's very important for us to be empathetic and sympathetic with our community when we are contacting them to discuss any issue that they have come up with. Okay, that is the end of my presentation. Does anyone have any questions for me?
Thank you so much. That was great. I did sort of track some through the chat. The first one was, what happens when the World Health Organization and the CDC disagree?
Okay, so it's happened before, and it happened actually with COVID. We actually have to go based on what the CDC and our VDA is telling us to do. For example, the CDC actually, about a year and a half ago, they started talking about how they were going to start with a new guidance. VDH did not accept that guidance until like 2 weeks later. So that's right there is a perfect example that even though the CDC or the World Organization or even VDH may not always agree with certain things, but we do follow the CDC. And then the guidance, sometimes we do have a little bit of veto power where we don't have to implement it immediately. We can implement it a little bit further down the line. I hope that answered your question.
Yeah, I think that was good. Can you explain the electronic transfer of medical records information to health department? What are the triggers that make it occur?
All right, so this all, what the way that works is, if it's a reportable disease, that's the number one. If it's something that is reportable, then it automatically will be transferred directly from the laboratory. Now, InVet, which is the Virginia system that we currently have for tracking all of this data electronically, there are some labs, not a lot, but well, yeah, there's a couple labs that we do not currently have in the system with us. So those labs they don't come electronically to us. Instead, they come either via email or via fax, or the doctor sends it to us. So as long as it is reportable, that is what triggers us getting that particular lab. And now getting it reportable doesn't mean that it's going to be negative or that it's going to be positive. If it's reportable, even if the result is negative, we still have to receive those. Now, when it comes to electronic health records, when we receive them from a hospital per se, that is based on a particular condition of interest. What we do is we go into the electronic service of the hospital and we retrieve the records, and the records come in a document format into VEDS as attachments. So those are the two different documents that we may receive.
We have a couple more. How does surveillance work, such as can a public health identify that one area of the country has a high rate of colon cancer? Can they ID that there's a high risk? What about illnesses occurring due to poor drinking water? Do you know what's happening in Mississippi where they could not get clean water due to poor systems?
No, I did not know about that in Mississippi, but the way surveillance works is that's part of what we do. And one of the things that I mentioned was there's 4 types of surveillance. Each of them works specifically on a different way. Like, for example, we have the one surveillance that is sort of dormant, and what they do is just track particular areas to see if there's any particular issue that is arising within that particular facility. And sometimes you may call them catchment areas, and that's where you have like a catchment area that is assigned to you, and you just pretty much are constantly surveying that particular area there. So that's how one of the ways that we catch disease. The other one is surveillance where something comes up in a laboratory or comes up in a examination or on another maybe rapid test or based on a person's diagnosis, and then we are notified of that information by the facility or the provider.
Awesome. Okay, how much does misinformation on social media cause problems for public health efforts?
Oh my God, a lot. A lot. When I worked at Loudon, I was there for about a year and a half almost. And I can tell you that, let's say 10 out of 10 calls, we had at least 3 people out of 10 calls that had some kind of misinformation. And sometimes the misinformation is because the information was told to one person, that person related. It's like broken telephone. If you remember when we were kids, we would play broken telephone. But the time the story got to the last person in the line, it did not, it was completely different than how the story started. So sometimes I don't think that it's always meant to be misleading, although some information, as we know, are in some websites that are very misleading because it's kind of propaganda. They want people to believe their particular agenda. So, sometimes people do it not meaning to be misleading, and some other times it is done on purpose, unfortunately. But we see that a lot, to the point where we actually have 2 different websites that we use with the CDC, where we go in just to review misinformation. And it's listed there, all the different things that people are saying and how we should communicate back after we hear them.
I remember that being an issue. So we have 2 sort of connected questions. They're from 2 different
Okay.
people, but so is artificial intelligence / machine learning being used to analyze data? And then also, how will you use AI to interview patients in the future?
How are we going to use AI in the future? I would have to say that I'm not privy to that yet. I don't know how we will be using it. I'm sure someone is thinking about it. I just have not heard about it yet. Are we using data? Yes, we use models. For example, the University of Virginia is one of the universities that we work with them closely on their models for surveillance and disease. And the models work by surveilling patterns of behavior and of disease that they see. And are they using artificial intelligence? Unfortunately, I do not know if they are at this point. They have a meeting every 2 weeks. Actually, no, they just changed it to every month. So next it's going to be next month because they just changed it. That would definitely be a question that I am going to ask, because that's a very interesting question. I would definitely ask that.
Myra, I know we have the Essence system, which kind of scans data from, like, chief complaint logs from hospitals, and then provides quote flags when there's potential for some kind of disease that we might be interested in. It's so old now, we don't think of that as AI, but it's an automated intelligent system that we use. Yeah.
Yeah, but you're right. You're right. I didn't even think of that. But yes, I'm thinking of the new chat and all that stuff. But yeah, it is a system that we do use. Yes.
Yeah, and I'll just point out, I hope that we don't use chat AI to interview people, because I think there's an important human aspect to interviewing people and to gaining trust and to get them. They don't want to talk to a chat AI. That would totally violate, I think, their feeling of trust in public health. But maybe the next generation might be more comfortable with it. So who knows?
True. I mean, they're sitting right next to each other and they're texting, right? So, I see my kids and I'm like, who are you talking to? He's like, I'm talking to so and so. I'm like, you're sitting right next to them. Why don't you try communicating instead of chatting? So, like you said, you're right. They might be more comfortable, but I do see that not happening soon.
Okay, just two more. If someone develops TB, what kind of surveillance moves from passive to active and so forth?
Okay. So if somebody has TB, the first thing is we're going to go ahead and find out, we're going to do a case investigation on that individual, figure out where they were, what kind of, like, for example, we can find out, have they been incarcerated? Have they been in a facility? Try to find localities or locations where they could have potentially been exposed to it, and then also find out where they could potentially have exposed others.
So and the last, sorry, go ahead.
No, go ahead. I was just going to say, go ahead.
Then the last one is VDH working on this kind of connects to Amy's question. Is the VDH working on something to deal with the amount of negative information regarding the COVID-19 vaccines?
So VDH per se has a list of questions and answers, sort of, that they have, but that information is linked directly to the CDC. The CDC is the one that has two websites. One of them, they're in collaboration with another external partner, and then one that they themselves have, where it talks about vaccinations and all of that. It talks about, it goes into the details of the individual vaccines, the pros of it, the information we know about the vaccines, and what we still don't know about the vaccines, because that's also very important. Being able to not only explain what we know, but also being able to say, but we don't know this yet. So it's not VDH per se, it's the CDC with other partners that has these two websites that I typically recommend.
Great. Well, that's the last of our questions. And I just have a little more